Hi, I am Dr. Virendra Budnoor, consulting orthopedic surgeon with Apollo Spectra Hospitals, Kondapur, Hyderabad. I am specialized in joint replacement and arthroscopic procedures of the knee, hip and the shoulder. Shoulder dislocation is an orthopedic emergency. The patient is usually put into a close reduction under anesthesia. Usually we can attain the reduction of the shoulder without any kind of anesthesia in the emergency room. Once the shoulder is reduced, the patient is put in a shoulder immobilizer for about 4 to 6 weeks. Post immobilization, the patient is put on a rehabilitation, usually in the physical therapist, where they are allowed to do a complete range of motion followed by strengthening exercises. In case the patient has a repeated shoulder dislocation, shoulder dislocations are much more common than hip dislocations because the socket of the shoulder is a small socket and it is prone for dislocation, more commonly on the anterior side of the shoulder. So if the patient has a repeated shoulder dislocations, the risk of redislocation is about 30% if he has one episode of dislocation. Patients with repeated shoulder dislocations need to be evaluated with the help of X-rays, CT scans and MRI scans. Here we try to evaluate if there is a damage to the cartilaginous structure which is attached to the glenoid surface, that is the socket of the shoulder. The cartilaginous structure, if it is torn, it usually doesn't heal. If there is an associated bony fracture, associated articular surface injury, the patient is advised to undergo an arthroscopic procedure where we repair the cartilaginous structure to the main bone with the help of suture anchors. If there is a small bony fracture, we usually neglect it and repair the labrum. If it is a big bony fracture, we usually fix with the help of screws. In case if the patient has a repeated shoulder dislocations more than 10 to 15 times, we do an open surgery called as a lateral J procedure where we try to increase the surface of the articulating surface of the shoulder with the help of another bone graft which is taken from the coracoid process of the shoulder joint. Here the patient is given an immobilization again for about 3 to 4 weeks followed by physical therapy. With physical therapy, the patient gains back its complete range of motion and complete strength in the shoulder. Thank you.